Yes, this is a very important question, in particularly for safety reasons. You all know that in the last 10 years, really, there's been a trend towards transferring only one embryo at a time. Is also known as elective single embryo transfer. And the reason why all the specialists like myself moved towards that trend is because primarily we want to reduce the chances of having multiple births, not just twins, but also triplets or quads, which was very common in the past. So it's a safety reason, but also because the technology and the IVF technology has improved over the last 10 years in terms of improvement in the culture conditions, in the drugs that we use, in the equipment that we use, the success rate seems to be very similar whether we transfer one embryo or two embryos. So the only potential side effect is that if you transfer more than one embryo, so two embryos, then you have probably 40-50% chance of having a multiple pregnancy, which can be quite problematic in terms of pregnancy, not just for the mother, but also for the babies. And it can increase the risk of miscarriages to start with, but also going through the pregnancy, the risk of intrauterine growth restriction, where the babies are basically not growing at the speed that they should, or causing preterm labor when the babies are born prematurely. So we really need to be conscious about all these potential complications, and that's why the trend nowadays is to transfer one embryo at a time. Obviously, this very much depends on the age of the patient, on the quality of the embryos, on the previous obstetrics history or previous failed treatment, IVF treatment. So there are lots of indications that we consider, and we discuss that usually with a patient. But the standardized practice, at least in Europe, is to go towards the transfer one embryo to be safe.